You know, when people ask me about spinal decompression therapy, I always tell them the same thing. Success isn't really about the therapy itself, it's about finding your perfect match. And what I mean by that is, look, there are so many myths floating around about this treatment that honestly, it's creating more confusion than clarity for people who are just desperately trying to find relief from their back pain. So let me be straight with you about what's real and what's not. First off, spinal decompression is not some magical cure-all for every type of back pain. That's just not how it works. This therapy specifically targets nerve compression issues like herniated discs or spinal narrowing. But if you're dealing with muscle strain or inflammatory conditions, it's probably not going to do much for you. And here's another thing people get wrong. They think these decompression machines work exactly like surgery. But that's not accurate either. These tables create traction forces that might temporarily open up disc space, sure, but they can't physically remove bone spurs like surgery can. Now, on the flip side, some people think surgery should always be the first option, and that's equally wrong. Good spine care starts conservatively, physical therapy, medications, maybe some injections, and we only consider surgery after months of conservative treatment haven't worked, unless there's something seriously urgent going on neurologically. And let's talk about expectations for a minute, because this is huge. You're probably not going to feel completely better immediately after any decompression treatment, whether it's surgical or non-surgical. Recovery takes time, sometimes weeks or months, and nerve healing has its own timeline that we can't rush. So, I also must emphatically say this. Success rates can be incredibly high with this treatment, but here's the kicker. That success really comes down to two critical factors. First, we have to make sure the patient is actually a good candidate for this type of therapy. Not everyone is, and that's okay. It's not for everyone. And second, and this is huge, the practitioner's skill level and their deep understanding of how the spine actually works makes all the difference in the world. The bottom line is this: spinal decompression can be incredibly effective for the right person with the right condition, but separating fact from fiction is absolutely crucial for making smart healthcare decisions. If you're dealing with back pain, find qualified spine specialists who can give you evidence-based recommendations that are tailored specifically to your situation, because remember, this is just educational information. It can't replace getting proper medical advice from qualified healthcare providers.